Good morning, everyone. Thank you for joining us today. My name is Rachael Cooper, the Senior Director of the National Stigma Initiative at Shatterproof. I am joined this morning by my colleague and co-chair, Alana Bolton, who is a program manager at Dell Medical School at the University of Texas at Austin. On behalf of Shatterproof, the Dell Medical School, we extend a sincere warm welcome to the 2022 Stigma of Addiction Summit. Over 2,000 people have registered to be a part of this monumental discussion about what stigma is, how it affects our communities, and perhaps most importantly, what we can do about it. Attendees at today's meeting represent a broad range of individuals from academia, from the government, from treatment and recovery organizations, from health plans and community-based organizations across the nation, and so many more from senior leaders to people providing direct patient care. Alana, do you have anything to share with our audience?
Thank you, Rachael, and welcome to our audience today. We have been planning this event quite literally since the conclusion of last year's inaugural summit, and would like to issue a very special thank you to our dedicated steering committee who have been meeting bi-weekly for the last several months to plan the programming of today's summit. All of these experts are identified on our website. It's also my pleasure to touch on some logistical housekeeping for today's event. All of the summit programming will be found embedded on the video stream on this webpage. If you're hearing my voice, you are in the right place, and this is where you should stay all day today. Our audience members can navigate between the various session spaces today using the 3 tabs at the bottom of this video stream. All of the plenary sessions and breakouts 1.1 and 2.1 will occur in the plenary and track A tab. 1.2 and 2.2 will occur in the track B tab, and breakout sessions 1.3 and 2.3 will occur in the track C tab. We are also welcoming audience questions during all of the sessions today. Audience members may submit questions for our speakers to address by using the Ask Your Questions submission box below the video feed on this page. We will do our best to answer as many questions as possible, but may not be able to get to all of the submitted questions. Finally, the summit today is accredited for various continuing education credits. All information about continuing education will be provided at the conclusion of the summit after our closing plenary. And with that, I will turn it back over to Rachael to get us started with today's programming.
Thank you, Alana. If we could move to the next slide, please, I will kick off the event. I am pleased to present Gary Mendell, CEO of Shatterproof, and Dr. Rahul Gupta, Director of the Office of National Drug Control Policy, to share a few words through these opening videos. Roll the tape, please.
Welcome, everyone. My name is Gary Mendell, and I am the founder and CEO of Shatterproof. And it is my distinct honor to welcome each of you to our second annual Stigma of Addiction Summit in partnership with Dell Medical School at the University of Texas at Austin. Reducing addiction-related stigma is vitally important. And as is the case with so many, it's personal to me. My son Brian struggled with addiction for 8 years. And he tried so hard. However, on October 20th, 2011, I was woken up in the middle of the night by my cell phone ringing. And when I picked it up, I was told that my son had just died. He was 25 years old and he hadn't used a substance in 13 months. And equally tragic, it wasn't just addiction that took my son's life. It was the feeling of shame he had every morning when he opened his eyes, of all day long feeling like an outcast. It caused him to wake up that morning, research suicide notes, write a note of his own, light a candle, and take his own life, alone. So why would someone 25 years old, apparently healthy, not having used a substance in over a year, take his own life? I've never had to wonder. He wrote about it in his note. He said, "Dad, It's about not being treated like a human after I've tried so hard to get back to normal. Brian couldn't envision a world where, as a young man, he could develop a disease, get treated based on science in our healthcare system, get better, and live a full and fulfilling life. Will that day transform my life? I have made it my personal mission to prevent other families from feeling the pain that my son felt and our family. As we all know, addiction is a worsening crisis. Since this summit a year ago, over 100,000 of our loved ones have lost their lives to a drug overdose. Another 100,000 have lost their lives of causes related to alcohol. These are our sons, our daughters, our mothers, our fathers, valued members of our society, and so many others. Many have responded. Many have responded with wonderful initiatives: harm reduction, prevention, interrupting the supply of drugs into our country. However, one of the most important components or causes of this death and this tragedy has not been touched in a big way, and that is stigma. And that is why Shatterproof jumped into it in a big way. We first partnered with the Hartford to develop the most comprehensive measurement of addiction stigma ever fielded. And the results, as expected, were startling, confirming that 75% of Americans and 65% of healthcare professionals hold the false belief that substance use disorder is not a chronic illness, when science proves that it is. 75% of the public and 65% of healthcare professionals. Recognizing this, Shatterproof developed a national strategy along with specific tactics and interventions to attack this, because this can be reduced. Research has proven it. We're already working in more than a half a dozen states and expect many more as we spread across this country to reduce and ultimately end this shame and stigma that is so destructive to our society and our families and our loved ones. To end the shame and social isolation that is touching so many of our families. I often think of the last time that my son came home for a visit, 4 months before he passed away. And that last night, we were sitting on the back porch talking about his favorite topic, the New York Giants and Eli Manning. And then the conversation turned to his recovery. And he looked at me and said, "Dad, someday, I wish that someday people would realize I'm not a bad person. I'm a good person with a bad disease. And Dad, I want you to know I am trying my absolute hardest." Well, Brian's wish has taken way too long to be accomplished, but it is in our sights. It can be done. So please join us. Join us, and together, let's drag addiction out of the shadows and into our hearts. I can't imagine a more perfect expression of humanity. Thank you for joining us. Let's do this together.
Thank you, Gary, for that warm introduction and for all you and your team have done to make sure that we treat addiction like any other disease. And hello to everyone around the country for participating virtually. I am delighted to provide the keynote at this year's Stigma of Addiction Summit. I want to begin today with a story that illustrates just what we're facing. As Gary mentioned, I've been a practicing physician for 25 years. I worked in cities as big as 25 million people and in rural towns where a patient paid me with fresh apple pie and homegrown tomatoes. I've treated many patients with substance use disorder who've gone on to lead successful lives in recovery. I've seen patients succumb to their disease, for I've attended far too many funerals. While treating patients at a clinic in West Virginia, I saw Sarah, a 67-year-old woman who started using heroin after her pain medication ran out. Now, she refused to enter inpatient treatment for her addiction because she said her adult son lived with her, and if she disappeared for several days, he'd find out that she had addiction. Just like so many patients who walk through the doors of that free clinic, we only see them when they ask for help, and Sarah decided continuing to use heroin. That was, for her, a better choice than facing the stigma of addiction. And that's what we're facing. And it's contributed to our country losing more than 107,000 lives to drug overdose last year. So how do we break this stigma? How do we make sure that people with substance use disorder can get the help they need and feel as though they can ask for it? And how do we make sure that healthcare providers treat them like they treat people with any other disease? We have the chance to eliminate stigma every day through our words and our actions. Since the administration began, President Biden and our team have been working to break the stigma around addiction and bend the curve on overdoses. In his State of the Union speech, President Biden announced his unity agenda for the nation. And first on that piece was beating the opioid overdose epidemic. In April, we took a major step to deliver on this goal by releasing the president's inaugural National Drug Control Strategy, which goes after the key drivers of the overdose epidemic: untreated addiction and drug trafficking profits. So let's talk about these drivers for a moment. Fewer than 10% of people who need substance use treatment are getting it. Folks, this isn't your parents' drug epidemic. In fact, it's the most dangerous drug environment we've ever seen because the drug supply is more lethal than ever before. New and deadly synthetic combinations can be created all the time, and polysubstance use is becoming common. We pay the price every time a child, a sibling, a friend, or a loved one develops addiction. In some ways, virtually every family in America has been impacted by addiction. So where are these drugs coming from? Too often, synthetic drugs are produced from chemicals made in China. They are routed through Mexico and handled by domestic criminal organizations right here in the United States. I was in San Diego recently, and we saw the border up close, both from the air and in the tunnel that drug traffickers have built. I can tell you that you have to have really strong incentive to build these tunnels. And they do, because trafficking is so lucrative. And this is where we are right now. So what can we do? We can lead with compassion. We can use the best science, evidence, and data available to guide our policies and target actions that will make a big difference, both today and in the future. The top 4 priorities of this strategy are designed to do just that. So first, the most important action that we can take to save lives right now is to have naloxone, the opioid overdose reversal medication, in the hands of everyone who needs it without fear or judgment. Especially today, when 3 out of every 4 overdose deaths involve opioids. But the reality is that stigma often prevents evidence-based programs like this from taking hold in communities. And that's why ONDCP released a model states law that states can use to expand access to this life-saving medication. Harm reduction interventions like naloxone enable us to work with people who use drugs to build trust and engagement and keep them alive. Now, I've seen harm reduction save lives, and it has bipartisan political support. So we're going to expand access to naloxone, a cost-effective tool that has the most potential to save lives today. Second, the President's strategy lays out actions to tackle a long-standing issue, which is that the majority of people with a substance use disorder are not getting the treatment they need. Now, research shows us that people with addiction are less likely to engage with the healthcare system out of a concern for how they'll be treated. Stigma discourages people with substance use disorders from seeking care. And if they do seek it out, they're less likely to receive the compassionate treatment that they need and so deserve. Now, we know that treatment saves lives. Everyone who wants treatment should be able to get it, and that's our goal. Through the President's strategy, we will double treatment admissions for the populations most at risk for overdose death and ensure that universal access to medications for opioid use disorders are there by 2025. Third, the strategy is unveiling a renewed focus on disrupting transnational criminal organizations and their illicit financial networks and supply chains. We've already brought the international community together recently to control fentanyl precursor chemicals. And President Biden's budget proposal includes substantial increased investments for border security and supply reduction. But we must do more. We have to hit drug traffickers where it hurts them the most, their wallets. Through the strategy, we will make it more costly for drug trafficking organizations in every way. Now, this work is critical because if it is easier to get illicit drugs in America than it is to get treatment, we will never bend the curve on overdoses. Fourth, the strategy ramps up our work on data and research at a time when the federal government faces large gaps in data collection and analysis related to drug policy. For example, we know that one of the best predictors of a fatal overdose is a prior non-fatal overdose. But we don't have a consistent and timely measure of non-fatal overdoses in the United States. Now, that limits our ability to identify emerging trends and act before it's too late. In addition to these four areas, the President's strategy also directs federal agencies to take actions to prevent youth substance use, support people in recovery, and advance racial equity in our drug policies related to both demand and supply. The strategy expands the scope of this work to address many factors that affect substance use disorder, including child poverty, employment, and economic opportunity, so people can reach their full potential. Now, taken all together, President Biden's national drug control strategy shepherds in a new era of drug policy. In the past, U.S. drug policy was focused more on stopping the flow of drugs than on helping people with addiction, in part due to stigma against people with addiction. Today, we recognize that addiction is a disease and should be treated like one, just like heart disease, diabetes, and cancer. So our approach includes breaking the stigma surrounding addiction so more people can reach recovery. Just because we may not want these diseases in our communities doesn't make them go away. People with these diseases are people like us and are deserving of the dignity and care. This is precisely why President Biden's budget calls for changing the outdated names of agencies that include substance abuse. For example, he's proposing changing SAMHSA's name from Substance Abuse and Mental Health Services Administration to Substance Use and Mental Health Services Administration. Now, words matter, whether they come from the government, the news media, family, or friends, or their medical providers. So what can you do? We need you to help us break the stigma. We need you to promote evidence-based harm reduction strategies, including naloxone and syringe service programs. We need you to make your voices heard about laws that will keep people alive, and you can find model state laws on ONDCP's website. If you are a medical provider, we need you to make sure that you're screening every patient and taking advantage of the new practice guidelines that allow you to treat up to 30 patients with opioid use disorder with buprenorphine. This is a comprehensive problem, and it requires us all to do our part. I'll leave you with this thought. Do we want the next generation to look back and see how stigma or gridlock stopped us from taking the necessary steps to save lives? Or do we want to be remembered as leaders who ushered in a new era of compassionate, data-driven, and high-impact action? Now, I will do everything in my power to save lives, and I know that I can count on you to do the same. As President Biden recently said to all those working to address addiction and the overdose epidemic, we're standing with you, and we will get you the support and resources you need to beat this. Thank you. Thank you for everything you're doing. And please don't hesitate to reach out if my office can be of any help. Thanks.
Thank you, Gary and Dr. Gupta, for your incredible words and messages. We are truly grateful for your time, passion, and commitment to ending addiction stigma.